Well, trade unions are continuing their strike at non-essential government departments because this is part of the ongoing public service strike. Workers are pushing for a 10% wage hike. Just yesterday, the Labour Court issued an interdict ordering essential service workers to go back to their posts. Let's find out now how today has gone so far, and let's find out if they are willing to stretch these demonstrations beyond today. Our reporter, fellow anchor here, Heidi Giokos, was out and about monitoring the strike in different parts of Johannesburg. She's back now. She's joining me now in the studio. Good afternoon, Heidi. Thank you for joining us on Today this afternoon. Wonderful to have you in Johannesburg for a change after you've been gallivanting around Cape Town. Okay, now let's talk about this strike. What did you see? I mean, you went to various places. Last time I crossed to you an hour or so ago, you were speaking to the SACP outside the Home Affairs office. We could see that there was not much activity happening there.
Yes, certainly. I must say it's a lot calmer today compared to what we saw yesterday and compared to last week, where health facilities were really under attack and were unable to operate at full capacity, with some hospitals even having to shut down completely. Yesterday, we saw the military health services being deployed to 2 specific hospitals here in Gauteng. But because of that court interdict that has instructed all essential Nehawu strikers to return back to work with immediate effect. We do know that Nehawu says it's just going to be non-essential workers. So they're now targeting government departments such as the Social Development Department, Education Department, eGov, as well as Home Affairs. This is probably going to catch up with government in a few weeks' time, because we do know that, for example, the Home Affairs in the city of Johannesburg was completely closed today because of the strike. So as much as it's not deemed as essential for now, the work is piling up. People want services. They aren't getting them because of this situation.
Death certificates, IDs.
There was one gentleman there that said, I'm in desperate need of an ID book, and I've come twice now, and they've told me that I need to come back when the strike is over. Unions are demanding that 10% wage increase. We do know that they've gone back now to talks with government, but the SACP, which is an alliance to COSATU and governments, of course, together with the unions, are basically blaming government for this mess, and they are saying that government should have listened to the concerns and the demands of this 10% wage increase, which they've been asking for since last year and possibly the year before, and they have called on government to not victimize those that have opted to be part of the strike. Let's listen to what the SACP said on that.
Our support is not only to Nehawu, but is to the entire public service union, because firstly, it was wrong for government to renege from agreements that they've signed, they've agreed upon, the 2018 wage agreement. And this is what has caused all these things. But again, we want to appreciate the discipline of the unions, because following the Labour Court judgment, which yes was unfortunate, but they were able then to engage with all their workers to go back to work, especially those that are essential. And we've seen that they've went back. We hope that actually government should be having the same heart of saying that they need to understand, instead of focusing on threatening workers with no work, no pay, and all other things, they need to then go to the table with a good heart and be able to find a solution before even the economy that is already dilapidated, that is collapsing, to collapse more.
Okay, that's the SACP, an ally of COSATU, an ally of the ANC, and showing its support there. But when you look at the strike in the last week, because of what has transpired with the hospitals, and we've even have, unfortunately, some deaths, and there's an investigation going on currently from what you've heard from the health department, Heidi, you just see Nehawu like they are the leader of this. But we have dozens, more than a dozen rather, public service unions and negotiations, and they've got this bargaining council. I mean, who else are you aware of is really participating in this strike?
Yes, I mean, even when we interviewed the SACP today, they were saying that it's not just Nehawu that's part of the strike, yet they are at the forefront of this. And Nehawu has come out to say that we need to get it very clear. It's not a health sector strike, it's a public sector strike. But what's important here is that the health facilities across the country have been severely affected, with 4 deaths reported so far and the possibility of even more. The health minister has not ruled that out. We have seen POP crew on the ground, and that's the union with mostly police officers. We have seen them on the ground marching and striking with Nehawu, but we haven't necessarily seen other unions partaking in the strike. They might be part of the negotiations and wage talks, but they're not necessarily part of the actual strike. We've just seen
there's been a lot of
Nehawu.
solidarity as well expressed, like by the SACP and other trade unions. So just to recap quickly, Heidi, so as far as you know from what you've been told, what you saw, the public service strike is continuing with non-essential staff. Essential staff are back in their post and negotiations are underway, but we don't know when they'll be concluded.
Yes, so we do know that non-essential workers are still partaking in the strike. We also do know that all healthcare workers in any healthcare facility, be it essential or non-essential, because how do you deem somebody non-essential in a healthcare facility? They have been instructed to go back to work. And I just want to add something again. DENOSA, mostly nurses have been severely affected in healthcare facilities, and this is why the military services, health services had to be brought in. But DENOSA did not want to partake in the strike. They might want to be part of the wage negotiations, but it's not that union that was part. It was mostly Nehawu that we saw that was affected when it comes to healthcare facilities.